am. I am at the International Association for the Study of Pain, the World Congress of Pain. And today is a poster session, and I found some colleagues from Brazil who are presenting a poster, and this is amazing because this is about a drug called dipyrone. And I used this drug when I was a kid in Brazil a lot. It's a medication for pain. It's an analgesic. And I'm so glad here because the authors of this study are here. So this is Dr. Cláudia Tambelli and Dr. Carlos Parada. And they are scientists from the University of Campinas, which is a state university in the state of Sao Paulo. It's a city of Campinas. And they are going to talk about dipyrone. This is a medication that we don't have in North America. I don't know why. It's a great analgesic. It's a great medication to treat pain. I know this because I use this all my life when I have pain. Unfortunately, I can't buy this in Canada. I know there are other parts of the world that may have this, but their poster here shows some very different characteristics of dipyrone that I did not even know. So, Cláudia, can you tell us about what is that you found here about dipyrone for inflammation?
For inflammation.
So hold this close to your mouth.
Yes, dipyrone is the most used analgesic in Brazil. And here in this study, we are showing that in addition to its analgesic effect, dipyrone also modulates the inflammatory
It's an
process.
anti-inflammatory or no?
It's not a classic. It's not a classic
anti-inflammatory.
Anti-inflammatory. Actually, it balances the ratio between macrophages type 1 and macrophages type 2. So it's good for tissue regeneration. So dipyrone could also be used in regenerative medicine to increase the tissue regeneration by producing this balance between macrophage type 1 and macrophage type 2.
Wow.
Yeah.
Very good. Thank you so much. Carlos, do you want to say something about the study too?
No, I think this is the main goal of this study is to show another kind of modulate the inflammatory process that can be more effective than the classical one. So this is more important for this study.
Yeah, is there anything that you'd like to show in the study here? Like, they're providing some data here. Look at this. Let me see if I can. So here is your poster, the figure here. Can you explain what is this figure? That's the two macrophages, type 1 and type 2. And so this drug has to be given in high doses, right, to promote this tissue regeneration.
Higher than the analgesic.
Or higher than analgesic dose.
And the type 2 macrophage produce the anti-inflammatory cytokines that counteract with the pro-inflammatory cytokines. This is important analgesic effect in inflammation pain.
Yeah. Okay.
Right?
Thank you very much. If I find something interesting here at the conference, I'll bring that to you. Thank you for watching. Leave your comments below, okay? Leave your comments in this video here. Did you like this kind of research? Would you like to have dipyrone available to you? Because if you go to Brazil, you can buy this in any pharmacy. You don't need a prescription. It's over the counter, has very little side effects. The side effects, I can't remember, there are no serious side effects. No side effects. Mainly just a little bit of sleepiness. People may feel a little bit more sleepy if they take, but not everybody. We give this for kids who have fever in Brazil. It's pretty safe. I don't know why we don't have this medication in United States, Canada, because it is amazing. Would you say that this is equivalent to acetaminophen? It's more effective than acetaminophen. Is there any research showing that it's similar or no?
Well, sometimes it's more effective because you can increase the dose because there's no side effect in
the liver.
The liver, of course. Yes, there is no toxicity, and you just be careful a little bit for the patients that have a problem in the nephrology.
On the kidney problem.
Yeah, the kidney.
If they already have a kidney problem, or it doesn't cause kidney problem.
It's common for all drugs. Right?
Yeah.
and sometimes the liver because it metabolizes in liver.
Yeah.
as
So
well.
this is much safer. It's what he's saying is that in terms of analgesic effects, it gives more analgesia than acetaminophen. But you can increase the dose, and acetaminophen we can't increase the dose because it's toxic to the liver. Acetaminophen or paracetamol causes toxicity. People can die of acute liver failure if they take too much acetaminophen or paracetamol, but this one here doesn't. So it's pretty safe, has great painkiller activities, analgesic activities, almost no side effects. It's sold over the counter.
Older studies said that
Older studies.
show that maybe dipron have some production of blood disease. But in fact, in Brazil, we use almost 100 years, and there is one case more than the other countries that don't use dipron. So for us, there is no problem with this kind of blood disease, and even the old studies show that one case in 2 million people.
Wow. Yeah.
So the cost benefits in terms of biological problem and the effectivity is very good.
Okay. Very good. Thank you so much. Thank you. Bye, everybody.